Hello, and welcome to our special session on the basics of Medicare. I'm Niki Trentacosta, your guide and expert at the Tanna Group. Whether you're nearing 65 or have already celebrated your birthday, understanding Medicare is crucial for your healthcare journey. Today, we're diving into the essentials of Medicare, breaking down its complexities to make your choices clearer and more manageable. Our journey today is not just about facts, it's about empowering you to make the best healthcare decisions for your future. Let's start with a little about us. The Tanna Group stands at the forefront of healthcare consulting with a focus on Medicare. Our journey began with a simple vision to demystify the complexities of health insurance. For over 15 years, we've been guiding individuals like you through the maze. Our approach is personal, our expertise is deep, and our commitment is unwavering. We don't just offer advice, we build lasting relationships to support you at every step of your healthcare journey. What drives us at the Tana Group? Two things: our vision and our mission. Our vision is a world where healthcare decisions are clear and accessible. We strive to turn the often confusing world of Medicare into a clear path for your health and well being. Our mission is simple yet profound: to provide you with understandable, tailored healthcare options. We believe in encouraging you with knowledge, equipping you to make informed decisions about your Medicare coverage. Let's talk about Medicare. It is a health insurance program run by the federal government. Specifically, the Department of Health and Human Services oversees the Centers for Medicare and Medicaid Services, or CMS. It's primarily for people age 65 or older, but it's also available to younger individuals with certain disabilities and people with end stage renal disease. Generally, if you're 65 or older, you qualify for Medicare. Now, enrollment timing is key. In enrollment, your initial enrollment period begins 3 months before you turn 65 and ends 3 months after your 65th birthday. Enrolling during this window is vital to avoid late penalties and ensure that your coverage starts when you need it. Additionally, there are special enrollment periods based on many different scenarios throughout the year. Understanding Medicare can sometimes feel like learning a new language. So, to help us navigate our journey, let's clarify some key terms that you'll often encounter. These seven terms are essential to grasp as they form the foundation of your Medicare knowledge. We discussed enrollment eligibility on the last slide. Next is government versus private. This refers to who manages the claims. Original Medicare Parts A and B are managed by the government, where Medicare Advantage and prescription drug plans, Medigap policies, these are all offered by private insurance companies and are regulated by CMS. Inpatient, outpatient describes the type of care you receive. Inpatient care involves an overnight stay in a hospital, while outpatient care includes services where you're not admitted to the hospital, like doctor's visits and same day surgeries. The term network is fundamental for Medicare Advantage plans. Network is a list of doctors, hospitals, and other healthcare providers that your plan has contracted with to supply medical care. There are different types of networks, including HMO and PPO options available to you. Moving on to the financial part of these definitions, the deductible is the amount you pay out of pocket for your health care before your insurance starts to pay. It's a set figure that you need to meet each calendar year. Now, your coinsurance is your share of the cost of any covered service. It's usually a percentage and kicks in after you've paid your deductible. Finally, the out of pocket maximum is the most that you have to pay for any covered services in one plan year. After reaching this limit, your plan pays 100% of covered services. Understanding these terms will help you better understand the specifics of your Medicare plan and help you make more informed decisions about your healthcare. Remember, the right knowledge is a powerful tool in managing your health and well being. Now, let's begin our journey through the parts of Medicare. We will begin with Medicare Part A, commonly known as hospital insurance. Part A is a fundamental part of Medicare, and it covers inpatient care. What does this mean for you? Well, if you need to stay in a hospital, use a skilled nursing facility, require hospice, or certain home health services, Part A is there to help cover these costs. The key point to remember about Part A is that for most people, it's premium free. If you or your spouse have worked and paid Medicare taxes for at least 10 years, you won't have to pay a monthly premium for this coverage. This is a significant benefit as it helps reduce your healthcare costs in retirement. However, there are still some out of pocket costs to be aware of. For instance, there's a deductible of $1,632 for each hospital stay. You must understand that this is not an annual deductible, but rather it applies to each time that you're admitted into the hospital. And while there's no coinsurance for the first 60 days of a hospital stay, extended stays will likely incur added costs. So the coverage under Part A is quite comprehensive for inpatient services. However, it does not cover long term or assisted living care. So consider planning accordingly. Part A is the base of your Medicare coverage. It's also the starting point for considering added coverage options, such as Medicare supplement plans, aka Medigap, or Medicare Advantage plans, aka Part C, which we will discuss later in this presentation. Second, let's explore Medicare Part B, also known as medical insurance. This part covers your day to day healthcare needs. Part B is designed to help you with the costs and services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Unlike Part A, most people pay a monthly premium for Part B through your Social Security account or wire transfer. The standard monthly premium amount in 2024 is $174.70 per month. But this can vary based on your income level. This concept is known as the Income Related Monthly Adjustment Amount, or IRMA. In other words, if your income is higher, you might pay more for Part B coverage. Another important aspect of Medicare Part B is the annual deductible, which is only $240 per year. After you meet this deductible, Medicare typically covers 80% of approved services, and you're responsible for the remaining 20%. This concept is known as coinsurance and should be factored into the healthcare budgeting. Note here that there's no network for Part B. This means that you can visit any doctor or healthcare provider in the United States that accepts Medicare. This offers a great deal of flexibility, allowing you to choose the providers that best meet your healthcare needs. Understanding Part B is key to effectively managing your outpatient medical expenses. While it covers a wide range of services, remember that it doesn't cover everything. Services like routine vision and dental care, hearing aids, and long term care are not covered under Part B. It's essential to consider these limitations when planning your healthcare. Let's look at some options to help meet these needs now. Part D, or prescription drug coverage, is the part of Medicare that is essential for anyone who needs medication regularly. Unlike Part A and Part B, Part D is offered through private insurance companies and is regulated by Medicare. Here's what you need to know about Part D. The cost for a Part D plan can vary. On average, the monthly premium is between $1 and $35 a month. This can differ based on the plan you choose and your income level, as well as geographic area. Remember, if your income is higher, you might pay more for Part B. Each plan has its own set of deductibles, and coinsurance is going to vary depending on the medication you need and the specific plan that you select. Also, Part B plans often have a preferred pharmacy, which means you'll get the best rates on medications when you use these pharmacies. Be sure to check whether your preferred pharmacy is in the plan's network before enrolling in the plan. Now, for some good news. There are limits on how much you're subject to pay out of pocket each year for your medications. In 2024, the maximum out of pocket is $8,000. But thanks to the Inflation Reduction Act in 2025, the annual out of pocket cost will be capped at $2,000 for Medicare Part B. Finally, just like with other parts of Medicare, you have specific enrollment periods. It's important to enroll in a Part B plan when you first become eligible to avoid late enrollment penalties. For example, if you don't sign up for Part D when you're first eligible and don't have other credible drug coverage, you could face a 1% penalty for each month that you were eligible but didn't enroll. This penalty lasts your lifetime. Understanding Part D is pivotal for managing your medication costs. It's all about finding the right balance between premiums, deductibles, and out of pocket costs while ensuring your medications are covered. As always, review your Part D coverage annually as plans and medication needs can change. As we navigate further into Medicare, let's discuss Medicare Supplement Insurance, also known as Medigap. These plans are labeled as Parts E through N. Medigap plans are offered by private insurance companies that are regulated by the federal government and are available to anyone who's enrolled in Medicare Parts A and B. Here's a brief overview of what Medigap covers. Medigap plans help pay for some of the healthcare costs that original Medicare doesn't cover, such as co-payments, co-insurance, and deductibles. Like original Medicare, Medigap plans typically don't have a network, so you can use any doctor or hospital that accepts Medicare. The different plan letters E through N offer varying levels of coverage that are all standardized by the government. So each plan design is the same, but the price may change between different carriers. Plan G is a popular choice because it offers comprehensive coverage, only leaving out the Part B deductible. Premiums for Medigap plans can range anywhere from $50 to $400 a month, depending on the plan and where you live. The last part of Medicare that we will be exploring today is Medicare Part C, also known as Medicare Advantage. This is the alternative to original Medicare and is offered by private insurance companies that are approved by Medicare. Medicare Advantage plans bundle Part A, Part B, and usually Part D prescription drug coverage. This makes it a convenient all in one choice. Many Medicare Advantage plans also offer extra benefits not covered under original Medicare, such as vision, dental, hearing, and even groceries. This can be a significant advantage if these are services you need or predict needing. One key thing to remember about Medicare Advantage plans is that they usually have a network of doctors and hospitals. This means that you may need to see healthcare providers within the plan's network to get the lowest out of pocket costs. It's vital to check whether your preferred doctors and hospitals are in the plan's network before enrolling in an Advantage plan. While many Medicare Advantage plans offer $0 premiums, it's vital to look at other costs like copays, deductibles, and out of pocket maximums. These costs can vary widely between plans. Also, you must be enrolled in Medicare Parts A and B in order to join a Medicare Advantage plan. And you can only switch, join, or drop a Medicare Advantage plan during certain times of the year, typically during the annual enrollment period from October 15th to December 7th. When considering a Medicare Advantage plan, think about your healthcare needs and lifestyle. If you prefer having your care coordinated and don't mind having a limited network of providers, Medicare Advantage might be a suitable choice for your needs. In summary, Medicare Part C offers a way to receive your Medicare benefits through private insurance plans with added benefits and potentially lower out of pocket costs, but with some network restrictions. It's a great option for those looking for comprehensive coverage and added benefits, as long as you're comfortable with those network limitations. Now that we've explored the distinct parts of Medicare, you might be wondering, how do I choose the best option for my needs? This is a crucial question, and the answer is unique to everyone. As we transition into the next part of our presentation, we'll focus on how to select the Medicare plan that aligns with your specific requirements, lifestyle, and financial situation. Our goal is to equip you with the information necessary for you to make an informed decision. Remember, it's all about balancing that cost and that coverage and some convenience to find a plan that offers you peace of mind and meets your healthcare needs. There's no one size fits all solution in Medicare. Let's delve in to option one for your Medicare choices, which is enrolling in only Medicare. This means that you enroll in Part A, your hospital insurance, which is generally premium free. The deductible, remember, is $1,600 per stay, and there's no co-insurance for that first 60 days of coverage. Then you enroll in Part B, which covers your day to day medical needs. Most people pay this monthly premium of $174.70 per month. And remember that it comes with that $240 annual deductible and the 20% coinsurance on any services. Original Medicare supplies broad coverage, but it doesn't cap out of pocket expenses. This is a major factor to consider, especially if you have a frequent medical needs. So, no out of pocket max. Option one for original Medicare offers a very comprehensive hospital and medical coverage. It is a solid base for your healthcare needs in retirement, especially if you value that flexibility and choice in your healthcare providers. Option two for your healthcare coverage combines the original Medicare we just discussed with prescription drug coverage or Part D. Let's break down what this option offers. Just like option one, you enroll in Part A and Part B. This is where option two differs from option one. You then enroll in a Part D prescription drug plan, which is essential for those who need those regular medications. The average cost for your Part D coverage is less than $35 a month, but remember this can vary based off of your plan. So, to summarize option two, you get the broad coverage of original Medicare with that added benefit of the prescription drug coverage. It's a suitable choice for people who need regular medications and prefer the flexibility of original Medicare. Now, let's explore our most robust option, which is option three, and it combines original Medicare with prescription drug coverage and a Medicare supplement or Medigap plan. This choice provides a comprehensive approach to your healthcare coverage. As with other options, though, you enroll in Part A and B, then your prescription drug plan, the Part D. But now this is where this stands out. You add on a Medigap policy, which is sold by the private insurance companies to help pay for some of those out of pocket medical costs that original Medicare doesn't cover, like those copays, that coinsurance, and the deductibles. Medigap policies come in distinct types, remember, that are named E through N, and the plans all offer various levels of coverage at varying costs. But remember, we discussed that Plan G is the most popular choice for its comprehensive coverage. The premiums, remember, for Medigap policies are going to be ranging from about $50 to $400 a month. So, closing out, option offers extensive coverage by combining original Medicare's comprehensive benefits with the added security of Medigap and prescription drug coverage Part D. This is an excellent choice for those seeking that peace of mind and predictability in their healthcare expenses. Finally, let's discuss option four, which is Medicare Advantage, also known as Part C. This option offers an alternative to original Medicare and is provided by private insurance companies that have been approved by Medicare. Medicare Advantage plans bundle that Part A, Part B, usually the Part D, and even some prescription, dental, and vision coverage. This means that you get all of your benefits bundled into one plan. That is one of the major attractions of Medicare Advantage, and suitable for our needs. Now, these extra benefits, they supply some significant value depending on your personal health needs. While many Medicare Advantage plans offer that $0 premium, you could be subject to some out of pocket costs like deductibles, copayments, and coinsurance. Another great feature to Medicare Advantage plans is that it does include an out of pocket maximum. So you do have some peace of mind at capping those potential expenses. So you've made a Medicare choice, but what if your needs and preferences change? Let's just discuss this flexibility and consideration of changing your Medicare plan. The good news is that Medicare offers an annual election period. It runs from October 15th to December 7th. And during this time, you can switch between Medicare Advantage and Original Medicare, change Medicare Advantage plans, or add or drop Part D coverage. This period allows you to adjust your plan based on changes in your healthcare needs or financial situation. Here is a key point to note about Medigap policies, though. When you first enroll in Medicare Part A and B, you have what they call a Medigap open enrollment period, during which insurance companies can't deny you coverage or charge you more due to any pre existing conditions. In conclusion, it might seem logical to enjoy the cost savings of Medicare Advantage plans while you're healthy and then switch to Original Medicare if your health needs change. However, keep in mind that switching back to Original Medicare might not guarantee you those same choices for costs and coverage as when you first became eligible. We've covered a lot of ground from understanding the distinct parts of Medicare to exploring the diverse options available to you. It's okay if you still have questions or feel uncertain about your choices. That is completely normal. Our goal, though, is to ensure that you feel informed and confident about your healthcare decisions. Each of you has a unique healthcare need and circumstance, and we're here to help provide you personalized aid, whether it's helping you compare plans, understand coverage details, or simply offering a listening ear to your concerns. As we come to the end of our journey through Medicare, I want to extend a heartfelt thank you for your time and attention. Navigating Medicare can be complex, but remember, you're not in this journey alone. The Tanna Group is here to help support and guide you every step of the way. Please feel free to contact us at the Tanna Group for any further help. You can visit our website, give us a call, or schedule a one on one consultation. We are here to help you make the best Medicare choices for your lifestyle and health.